How can Medicare protect you during international travel? Are you planning a trip abroad and wondering how Medicare can help if you need medical care while traveling? Let's break down the important details you need to know. First, it is essential to understand that Medicare generally does not cover health care services received outside the United States and its territories. However, there are some specific situations where Medicare can provide limited protection during your travels. One of these situations is emergency coverage abroad. If you find yourself in a medical emergency while traveling, Medicare Part A, which is hospital insurance, and Part B, which is medical insurance, may cover certain services. For example, if you are in the United States when an emergency occurs and the nearest hospital that can treat you is in a foreign country, Medicare may help. Another scenario is if you are traveling through Canada on the most direct route between Alaska and another state. If a Canadian hospital is closer than the nearest U.S. hospital, Medicare may cover your care. Additionally, if you live in the United States and a foreign hospital is closer to your home than a U.S. hospital that can treat your condition, Medicare may also provide coverage, even if it is not an emergency. In these cases, Medicare typically pays 80% of the billed charges after you meet your annual deductible. Next, let's talk about cruise ships. Medicare Part B may cover medical services received on board a ship within U.S. territorial waters or within 6 hours of arriving at or leaving a U.S. port. However, if you need care while the ship is in international waters, Medicare generally does not cover those services. When it comes to prescription drugs, Medicare Part D does not cover medications purchased outside the United States. If you need medications while abroad, you will likely have to pay for them out of pocket. However, Medicare Part D does cover certain vaccines recommended by the Advisory Committee on Immunization Practices, such as those needed before international travel, without any copayment or deductible. If you are enrolled in a Medicare Advantage plan, which is also known as Part C, it must cover at least what original Medicare covers, including the limited emergency coverage abroad. Some Medicare Advantage plans offer additional benefits for emergency and urgent care services during foreign travel, but coverage can vary widely. It is crucial to check with your plan provider to understand your specific coverage and any restrictions. Keep in mind that traveling outside the United States for more than 6 months can lead to disenrollment from Medicare Advantage plans. Lastly, because Medicare's coverage outside the U.S. is limited, it is wise to consider purchasing separate international travel insurance or medical evacuation coverage. This can protect you against high medical costs abroad. Always carry your Medicare card and any supplemental insurance information with you while traveling. Before you go, consult your Medicare drug plan about vaccine coverage and discuss with your healthcare provider which vaccines or medications you may need. Remember, Medicare's coverage abroad is primarily designed for unexpected emergencies and not for routine or planned medical care. Understanding these details can help you travel with peace of mind.